we're going to be measuring knee flexion. So you're going to put the fulcrum on the lateral epicondyle of the femur, the stationary arm on the lateral side of the femur, and the movement arm on the lateral side of the fibula. And then you're going to have them flex their knee. And she has 137 degrees of knee flexion, which is normal because normal is 135 to 145 degrees, and it is a soft end feel. And then for passive measurement, everything goes in the same place. And she has 138 degrees of passive knee flexion. Okay, to measure knee extension, you're gonna have your patient lying supine. You're gonna have the fulcrum at the lateral epicondyle of the femur, the stationary arm at the lateral midline of the femur, the movement arm at the lateral midline of the fibula, and then you're gonna have them extend their knee. Did you? Mm-hmm. Interesting. And she has 5 degrees of flexion, and the normal range is extension, and the normal range is 0 to 10 degrees.
I'm measuring hip flexion range of motion. The fulcrum is placed on the greater trochanter. The stationary arm goes the midline of the abdomen, and the movement arm is down the lateral side of the femur. Okay, actively flex. Alright, she is at 140. Passive. She gets a little bit more. She is at 150. Normal is between 0 and 120, and there should be a soft infield because of her stomach. I'm measuring hip extension. The fulcrum goes on the greater trochanter. The stationary arm goes down her abdomen, and the movement arm down the lateral femur. Alright, can you lift your leg off the table? Make sure she's not overcompensating. Relax. She has 22 degrees. Alright, for passive. She gets 30 degrees. Normal is between 0 and 30, and there should be a firm infield.
Okay, so for adduction, you find the ASIS. That's where the fulcrum goes. The movement arm goes like along to the other ASIS, and the movement arm will go down the midline of the femur. So for adduction, we're going to want to slide this leg over, and then I'm going to have Jacqueline adduct for me. And she gets about 30 degrees, which would be normal. Normal would be 0 to 30 degrees. So we'll reset, and I'll do it passively. And she'll get about 32 degrees, which is kind of barely abnormal. And then we'll go for abduction. The setup is basically the same. And then I'll have Jacqueline adduct her leg for me. And she'll get 30 degrees with that one as well, which is normal. Normal is 0 to 45. We'll reset. And I'll abduct. And she'll get 40 degrees with that one, which is normal as well. And the infields will be firm. Okay, so we're going to be doing external rotation. So you start with the fulcrum over the anterior aspect of the patella. The stationary arm will be perpendicular to the floor, and the movement arm goes down the midline of the tibia. And so I'll have Jacqueline externally rotate for me. And she'll get 30 degrees with that one. A normal range of motion would be 0 to 45 degrees. We will reset, and then I'll do it passively. And that one's about 32 degrees. So again, that's normal. So we'll do internal rotation next. The setup is basically the same as external rotation. And so this time I'll have Jacqueline internally rotate. And she gets about 35 degrees with that one. So normal range of motion is 0 to 45 degrees. We'll reset, and we'll do it passively. And she'll get 40 degrees that way, and so that's still normal. And the infields will be firm for both.